இது என்னது லைவ் ஸ்ட்ரீம்
மீட்டிங்கை லைவ் ஸ்ட்ரீம் போட்டிருக்கிறேன் சார். ஸோ தட்
லைவ்
பீப்புள்
ஸ்ட்ரீம்
கேன் வாட்ச். இஃப் தே ஆர் நாட் ஏபிள் டு ஜாயின்னா அப்புறம் கூட போய் பார்த்துக்கலாங்க சார்.
சார் நாட் ஆடிபிள்.
சார் இப்போ கேக்குதா?
பண்ணிட்டு போறவா?
குட் ஈவினிங் சாந்தி மேடம்.
குட் ஈவினிங் சக்தேஷ். எனக்கு வீடியோ சரியா கிடைக்காது.
ஓகே 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 மேடம். குட் ஈவினிங் ஹரி.
குட் ஈவினிங் சக்தி.
முடிஞ்சிருச்சா கிளினிக்கு? இல்லை இன்னும் இருக்கிறாங்களா பேஷண்ட்ஸு?
எல்லாம் இருக்கதா செய்யறாங்க சக்தி.
இருக்கிறாங்களா? உங்க பேஷண்ட் என்ன பாஸ் கரெக்டா 8:40 வராங்க.
கிளம்பிட்டீங்களா?
அது வந்து நான் இங்க பார்த்து அனுப்பிச்சேன்.
இப்ப இன்னைக்கு பார்த்து அனுப்புனீங்களா? இப்ப அனுப்புனீங்களா?
நீ அங்க இருந்து அதை விரட்டி விட்டதுக்கு அப்புறம் பார்த்து அனுப்பிச்சேன்.
இல்ல நீங்க நேத்து சொன்ன பேஷண்ட் இப்ப வந்தாங்களா?
வேற பேஷண்ட் வேற பேஷண்ட் வேற பேஷண்ட்.
ஓ சரி, நான் அதுதான் சரி உங்களுக்கும் அடிச்சேன். நான் ஹரி பேசிக்கிறேம்மா. அந்த பொண்ணு நேத்து நீங்க திட்டினதுல பயந்து வந்து கேட்டுச்சு ஹரி பேஷண்ட் சார் அப்படின்ட்டு. இல்லம்மா நான் மீட்டிங்கை ஸ்டார்ட் பண்ணோம், நான் ஹரி சாருக்கு ஃபோன் பண்ணி சொல்லிடுறேன்னு சொன்னேன் நானு.
மாறி போச்சு.
பிரசிடென்ட் சார் ஸ்டார்ட் பண்ணிடலாமா சார்?
எஸ்மா ஸ்டார்ட் பண்ணிடும்.
ஓகே ருக்மணி மேடம், இட்ஸ் 9 ஸ்டார்ட் பண்ணிடலாமா? மேடம் ஷால் வி ஸ்டார்ட் மேடம்?
அதான் ஆடியன்ஸ் வரணுமே, ஒத்துருமே இல்லையே. டாக்டர் ஹரிஹரன் இருக்காரு.
ஹரி இஸ் தேர். ஸ்பீக்கர் டாக்டர் ஸ்ரீராம் ஹஸ் ஜாயின்ட். சாந்தி மேடம் ஜாயின் பண்ணிட்டாங்க.
நான் இருக்கிறேன்.
மேடம் this meeting is now streamed live on YouTube also.
Okay.
We can because it's on YouTube, we can always share the link with people so that if they want to watch it, they can also watch it leisurely.
Okay.
So I think we can start the program, madam.
Okay. Okay.
So that's why join.
Yeah. Will you be? Why? இல்ல நாங்கெல்லாம் ஜாயின் பண்ணிருக்கோமே. Yeah, sure. I will message. Okay. So the legal advisor is unable to join, it seems. I will send him though.
Okay.
Please start பண்ணிடுவாங்க.
ஸ்டார்ட் பண்ணிடலாம்ல மேடம்?
It's up to you. நீங்க தான் host.
Okay, madam. Or maybe we'll wait for another 5 minutes, madam. After 5 minutes, around it. Now it is 9:03.
Okay.
Probably 9:10 we'll start, madam.
Okay, okay. Thank you. அதான் இன்னும் கொஞ்சம் நம்ம கொஞ்சம் பங்க்சுவாலிட்டி தான் நம்ம கல்ச்சர்லயே கொஞ்சம் ப்ராப்ளம்.
ஜனனின்னு ஜாயின் பண்ணிருக்கிறது இவங்க.
அவங்க மெடிக்கல் ஸ்டூடெண்ட்.
ஓ ரைட்.
அவங்க இப்பதான் எம்பிபிஎஸ் முடிச்சிருக்காங்க.
ஓகே ஓகே.
I told her if she is interested she can join.
ஓகே ஓகே ஓகே.
So
இல்ல
she is
I
joining.
thought ஒருவேளை சங்கீதா ராஜா மேடமா சங்கீதா ராஜா மேடம் she is now joining.
Janani,
Yes, ma'am.
you can introduce yourself.
Yes, good evening, everyone. I'm Janani. So I'm studying in Melmarvattur. Now only I completed my MBBS final year theory examination. So I'm waiting for my practical examination.
Very good, very good.
Thank
Welcome,
you.
welcome.
Thank you, sir.
Sri Pratap sir, good evening.
Yes sir. Yes, shall we start sir?
Hello, good evening.
9:10க்கு இப்ப ஸ்டார்ட் பண்ணலாம்னு சொல்லியிருக்காங்க சார்.
9:10. Okay.
ஆமா, இன்னும் கொஞ்சம் மக்கள் வரட்டும்ன்றாங்க மேடம்.
Sure, sir. Yes.
Dr. Pratap.
Yes, ma'am.
Yeah, thank you for joining us.
No problem, ma'am. Yes. It's a very useful list of topics.
Thank you.
Which
We
motivate-
expect some proposals from your institute.
Yes, ma'am. Yes.
Okay, thank you.
I've made all the speakers co-host, madam, so they can share
Yes.
their screen.
Screen, okay, okay. I invited everybody.
They'll all join around 9:15. That is how things happen, madam. They'll all join.
Okay.
Should I call somebody in the list, madam?
Yeah. Dr.
Yeah.
Umayal madam also I invited.
Yes, yes, I see the list, madam. Maybe I'll just give them a ring anyway.
Okay.
Dr. Anand, Mr. Anand has joined. Welcome.
Joined. Yes, yes.
సరే.
Hello. So we'll start, I think, 9:10 ஆயிடுச்சு.
Okay. Secretary sir, shall we start?
Yes, yes, sir. Yes, sir. We'll start, sir.
Yes, sir.
Good evening, everybody. So, on behalf of Research Committee, Indian Medical Association, Tambaram, it is honor to welcome you all for this webinar on how to write a paper, how to write proposals for ethics committee submission. So we have three distinguished speakers who's going to be talking about these topics. To begin the proceedings, I would like to welcome our president, Dr. Perumal sir, to welcome the gathering. Perumal sir.
Yes, sir. Yes, sir. So good evening all. So I welcome the speakers, Dr. Rukmani ma'am, Research Committee. So who is the person involved in starting the research committee in last September 2023, and it was approved in January 10th of 2024. And the founder members under the guidance of Dr. Raghavelu, Dr. Umayal ma'am, Dr. Sai Meenakshi, and Dr. Jamuna. So the team, they involved in starting the research committee in IMA Tambaram. So I welcome all the founder members and research committee speakers. So Dr. Sangeeta Raja and Dr. Sriram and all our EC members, ethical committee members, Dr. Raghavelu, Ravishankar, not, in the participant list. You have to welcome Dr. Murugan, Dr. Miriam, and Mrs. Niranjani, layperson, and lawyer Dr. L.K. Anand, Dr. Bharat Kumar, Dr. Vijayalakshmi. And I welcome all the IMA members who have joined this meeting. And it will be the first meeting to start with the research committee. And we have an in-person meeting April 21st. Half a day meeting will be there. The first meeting we will initiate with these small numbers of participants, and it will be a success in future. And I wish all the success of this program today. Thank you, sir.
Thank you, President sir. Indian Medical Association has been a pioneer in a lot. Tambaram has been a pioneer in a lot of things, and having an ethics committee for our own members is a unique thing. I don't think any other Indian Medical Association branch has an ethics committee of its own. It is a great honor and privilege to have an ethics committee of our own. In this regard, I would like to thank all the people, visionaries who have had the thought of having an ethics committee for our branch. So Dr. Raghavelu sir, Dr. Rukmani madam, who have taken all the efforts in making sure that we have an official ethics committee. So as our president mentioned, we are going to have our first ethics committee meeting, during which proposals can be presented by our members and from outside for ethics committee approval. And we have that on 21st of April, which is a Sunday. So the details of which will be shared as and when it gets ready. And so in this regard, see, we wanted to have a meeting to kind of make people aware of how to submit a proposal, how to write a paper, how to get a consent. All these things need to be informed. So that's why the research committee people wanted to have a meeting for our members to be informed in this regard. So we have three talks today. One is going to be how to submit a proposal, and the second one would be how to get an informed consent, and finally how to write a case report. So we have three distinguished speakers, Dr. Sriram, Dr. Sangeeta Raja, and Dr. Jamuna Rani, who's going to be talking to us about it. So to begin the schedule, we have the first talk, which is going to be on protocol writing by Dr. Sriram Selvaraju. So he is a scientist D, medical, and the head of Department of Epidemiology in ICMR, National Institute of Research in Tuberculosis. He has done his undergraduate and residency from Government Mohan Kumaramangalam Medical College, Salem. And he has done his MPH from National Institute of Epidemiology, Chennai, Sri Chitra Tirunal Institute of Medical Sciences, Trivandrum. So he has held various positions in Apollo, Vellore, and in various positions as scientist in National Institute of Epidemiology, Chennai. And he has published various papers and he has been trained in various distinguished institutions across the world. And he's been a teacher for students of Master of Public Health and Postgraduate Diploma in HIV Epidemiology in ICMR School of Public Health and National Institute of Epidemiology, Chennai. And he's got several publications to his credit. Over to you, sir. Sriram sir will be talking to us about protocol writing.
Thank you, sir, for the introduction. First, I would like to thank the IMA members for this webinar on research methodology and how to write a research protocol, how to write case reports, and how to do informed consent process. So I would just share my screen. Is my screen visible? Slide visible?
Yes, sir, it is visible, sir.
Okay. So I would be talking on writing a protocol for a research study. So usually when we say protocol, these are set standards which will guide us. What are we going to do? How are we going to do? And then what time frame? That is the main purpose of having a protocol.
I got it.
Sorry.
No. You can proceed, sir.
So having a protocol will help us focus on what we need to do, in the absence of which we will not have a clarity and direction on what problem we are going to investigate or what problem we are going to find solutions for. So that is the importance of having a protocol made ready and work further to identify problems or find solutions through a research methodology approach. So the competency that needs to be gained from this lecture is we need to see how we write a protocol for a research study. And there are three important areas that we would be discussing. So when we say about a protocol, we start with having a concept paper developed and expand the concept paper into a first draft of the protocol, and then share it to get a peer review, revise, and then finalize the protocol. So these are the three important stages of developing a protocol. First is having a concept paper. Second is expanding a concept paper into a first draft of the protocol. Then getting feedback on the protocol on what could be the strengths and weakness and how that could be improvised to become a final protocol. So that is the process of reviewing and revising. So these are the three main areas that we will be covering in this lecture. So first we will see on how to write a successful protocol in a stepwise manner. So these are the 7 steps of a successful protocol writing. First is identifying a topic, research question, and objective. Next is outlining a 1-page concept paper, then prepare dummy tables, write draft protocol, prepare instruments and annexes, then submit to peer review, and then seek ethical committee clearance. These are the 7 steps of developing a successful protocol. Now we will see how to identify topic, research question, and objectives. So this is the life cycle of a research study or an investigation. It always starts with the data needs. So the first step is to identify what are the data needs, then translate the data needs into a research question. Then from the research question, we should formulate our study objectives. And from the study objectives, we should plan what analysis we are going to do. And from this analysis, we should be able to identify what are the variables that are required to do this analysis. and those variables needs to be converted into data collection instruments. And once we develop this data collection instrument, we should use that to collect the data. Then we analyze the data, draw conclusions, formulate recommendations, and involve the program or give feedback to the problem with which we started the research. So this is the life cycle of a research study or investigation. In this, the first three components are important in identifying the problem and framing the research question and formulating the study objectives. This will help us in moving towards development of a concept paper. Unless we are clear on these three steps, it is difficult for us to narrow down on a concept that we need to do research on. So that is why identifying the process is important. So we need to start with the data need or a gap in information or a problem that we wanted to do research on. So that is the starting point of any research investigation. So working with public health managers, policymakers to identify data needs. So we need to identify a significant problem to do a research. So that is why we need to see which is a public health significant problem and then identify the estimate of importance of the public health problem, analyze the problems and review what is being already done and identify the information needed to improve. This will help us in identifying what data is needed for which we need to work on a research protocol. And that will help us in identifying what is the research question. So here we should frame the problem statement in public health terms, focus on one issue. It should be written in everyday language. We can use more than one verb. It should be general. And we should try to link the question to the potential action that would be taken once the question is answered. So this is how we develop a research question. So now we are trying to see that we started with a research problem or a data need. From that, we are translating into a research question. So this is an example for a research question. We would like to understand why some tuberculosis patients do not complete their DOT treatment so that we could address the issues and improve the completion rate. So this is an example for a research question that we would like to understand. And based on the research question, we should formulate our study objectives. Frame the problem in epidemiological terms, take the question in few limited access, and it should be written in epidemiological language. We should make use of no more than one verb, and then maybe sorted as primary and secondary, and should be clear about whether they call for testing a hypothesis or they call for measuring a quantity. Usually objectives are of two types. One, it will either test a hypothesis or it will be a estimate of a quantity. So these are the two things that we always do in research. Either we estimate a quantity or we test a hypothesis. If we estimate a quantity, that is called descriptive studies. If we test a hypothesis, that is called analytical studies. So our objective should either be descriptive objectives or analytical objectives. That needs to be understood very clearly. So this is an example for study objective. So compare defaulters and non-defaulters in terms of a number of characteristics that may be associated with observance among tuberculosis patients treated with directly observed therapy. So this is an example for study objective. So here we are trying to find what are the characteristics that are associated with defaulting in a TB patients on treatment. So this is an analytical study where we try to find an association between exposure and outcome. Here we test a hypothesis. So whenever you see compare, association, so those are related to analytical studies, analytical objectives. So first steps in practice. So write a short presentation in terms of summarize the background, start from a problem statement, document the importance of the problem, analyze causes and consequences, summarize what is being done to address it so far, make an inventory of the known and the unknown. In research, we always move from known to the unknown. So that is the approach. And write a research question, specify the study objectives, anticipate what would be done with the results in hand. So these are the processes which we undergo in developing the protocol. Then share with the public health managers, mentors, then revise, and revise. So now we understood how to identify a problem, how to develop a research question, how to develop an objective. Now with this elements, we will move to learn how to write a one-page concept paper. Because for writing a one-page concept paper, we need to have narrowed down to an objective. Because only if we know an objective, we can think how we can write a one-page concept paper. So rationale for using one-page concept paper is we need to have a concept on how we are going to do research in a precise manner. Because time is precious for both you and your supervisor or mentor. So brevity forces focus. So we have short time. We need to write what we think in our mind and what we have understood from the background literature search and review of information and gathering from the people that we had discussed. We need to put that into a concept paper so that it could help us focus what are all the important things that we are going to do. And in many situations, concept papers are not developed. They are already made available whenever you have some thoughts. So save time for an idea that may abort. Because if you have some thought on how to address a particular problem, you should immediately note it down and keep it somewhere recorded. Then whenever you require to submit a proposal, you can expand on that. That is the idea of having a one-page concept paper. So this is the outline of one-page bullet-style concept paper. So it has only 5 components. What is the background and justification of this problem that you are going to address? And what are the objectives? What method you are going to follow? And what is the expected benefit of this research? And what is the budget required? This is the one-page outline which we need to initially develop. That will help us focus on the direction of further research that we are going to do. So in the background and justification section, we should write what is the importance of a problem in terms of what is the prevalence, what is the incidence, what is the mortality, and what is being done to address it. In order to reduce that disease burden, what is the intervention currently happening? What tests are there? What treatments are there? What prevention is there? That is what is to be addressed. Then the information that is missing to prevent or control more effectively. What is not there that is required to be available for doing more effective prevention or control of a disease or mortality, that needs to be understood. That is the gap in information that we should end in the background and justification section. And that is for that gap in information or missing information, we are going to do research. So from there, the identification of data needs starts, and that gets translated into research question and objectives. So this is an example for background and justification of a bullet style concept paper. So in India, anemia is common among adolescent girls, particularly tribes. So here we are saying the problem of anemia among adolescents in tribal area. That is the problem statement. The government of India supplements adolescent girls with iron and folic acid in several states, but not in Madhya Pradesh. So this is the current status of the situation. So currently they are providing adolescent girls with iron supplements in several states, but that is not happening in Madhya Pradesh. That is our problem statement, missing information. So it is unclear whether it is feasible to supplement tribal adolescent girls with iron and folic acid in Madhya Pradesh. So here, this is what is the hypothesis that we wanted to test. Is it feasible to supplement tribal adolescent girls with iron and folic acid in Madhya Pradesh? So at the end of the study, we would be able to tell whether it is feasible or not feasible. If it is feasible, then that they would make it as a policy. So from this, we would be moving to objectives. In objectives, we would be having 2 to 3 objectives. It can be general and specific, and it can be sorted as primary and secondary. So this is the example for objective. So our objective is to estimate the prevalence of iron deficiency anemia among adolescent girls before and after pilot supplementation intervention, and identify the factors associated with coverage. So here, to start with, we are saying what is the prevalence of iron deficiency anemia among adolescent girls before the supplementation program. And after supplementation, what is the prevalence? Is it changing or not? That is what we are going to see. And we are also going to see what are the factors associated with coverage. So that is where we are trying to see what are the factors that are associated with feasibility and coverage. So these are the example for objectives. Then we move to the methods. So here we outline the methods and one bullet per point. So in terms of methods, we usually describe these elements. So what is the study design we are going to do? What is the study population where our data collection or intervention is going to happen? And what are the operational definitions for the research study that we are going to do? And what is the sampling procedure? How are we going to select our study population? What is the method that we are going to do the sampling? And then sample size. Sampling procedure is how are we going to draw the samples? Sample size is how many samples are required. These are two different elements. And then data collection, how are we going to collect the data? Then how are we going to analyze the data? And then human subject protection, how are we going to take care of the human subjects that we are going to involve in the research study that we are going to do. So these are the main elements of methods. So if you see here, now we are moving from objective methods. In objective, we are telling what we are going to do for addressing a problem. In methods, we are telling how we are going to do. So this is the example for the methods in terms of study design. So we are going to do a pilot intervention with pre and post cross-sectional studies. So this is an experimental design where we are going to do an intervention with anemia, intervention with iron and folic acid supplementation. So here at baseline, we'll be doing a survey of understanding what is the prevalence of anemia among adolescent women in tribal areas of Madhya Pradesh. Then we are going to do iron and folic acid supplementation. Then after a certain period, we are going to do another survey to see how is the prevalence of anemia among the same population after intervention. And as I said, the population is adolescent tribal girls aged 12 to 19 years. So that is the population, and Mandla district in Madhya Pradesh, India. So that is the place. Next, operational definition. So we have planned to use WHO criteria to define anemia. Sampling procedure is cluster sample of the study population. Sample size is considering 95% confidence interval, 20% beta error, allowing 20% dropout, expecting a difference of 1 gram percentage of hemoglobin level. A total of 168 adolescent girls will be required. So the first one is how are we going to select this 168 people? So for that only we are going to use cluster sampling. Second is what is the total number of study participants required for this study? And that is 168. And how did we achieve that 168? With those input parameters. So now we have defined what is the methodology in terms of design, what is the sampling procedure, what is the sample size. Next, we should tell from this 168 people, how are we going to collect the data? So this is using field workers. We will be collecting data under supervision of primary investigator. We will collect baseline and post-intervention estimation of hemoglobin using cyan methemoglobin method. So here, the primary important data point that we are going to collect is hemoglobin. And then what method we are going to use? Cyan methemoglobin method. And collection of data using semi-structured questionnaire on demographic characteristics, knowledge, and socio-cultural practices after the intervention. So that will help us in identifying what are the factors that are associated with feasibility and coverage. So who are taking, who are not taking, that will help us in understanding how we can improve further coverages. Next is analysis plan. So we have defined what is the methodology, what are the number of participants required, how are we going to select the participant, then how are we going to collect the data. Now, once we have collected the data, we need to tell how are we going to analyze the data. So that is where we have descriptive and multivariate analysis of the data to estimate the prevalence of anemia before and after intervention. So now we need to think the first flowchart that I explained, the life cycle of a research investigation. So you need to try to link between the objective and analysis plan. So in the analysis plan, the variables that are required for analysis should help in answering our objectives. That is very critical. So estimate the prevalence of anemia before and after intervention and identify factors associated with tablet consumption and anemia in the post-intervention phase. So these are the analysis that we would be planning to do. Human subject protection. So we need to ensure how we are going to ensure the confidentiality of the data that the participant had provided to the investigators. So we need to describe that in the protocol. Then we need to tell how are we going to get the informed consent. So we are going to get return informed consent and from the adolescent girls and their guardians, because they are adolescents. So it is better to take parental consent also. And then protocol submitted for ethical clearance. So once this protocol with all the data collection instruments and informed consent, participant information sheet, everything is finalized, we should submit to ethics committee for them to review and give an approval so that we can use that forms for data collection. And we should tell what is the expected benefit, what action will be taken following the results, and what future operational research agenda could further be done in this area of anemia in tribal women. And then the next component is output. Expected benefits. So here we expect to submit a document report shared with the local health authority so that they can work on the results to expand further in that area and enable local authorities to implement the program on larger scale after taking cognizance of compliance issues identified through the study. So any evidence that we get should be shared with the public health managers or the research managers so that they convert that into a policy or implement in a program so that larger people get benefit. Budget, we need to have a rough idea of what are the requirements in terms of various items. We need to have 4 to 5 line items. No detailed justification is required at this moment. We should consider for salaries, per diem, travel, equipment, supply and miscellaneous items. So there should be a rough budget in the concept stage paper. So this is an example for budget, per diem, travel, supplies, total. So this should be giving a rough initial estimate. Next step is preparing a dummy table. So first we saw a topic which we are going to do research on. What are the research questions? What are the objectives? Then from that we expanded to a one-page concept paper. Now we have one-page concept paper which tells us what are your objectives and what are your analysis plan. From that we need to see how we are going to develop dummy tables. So the dummy tables are nothing but tables without the results which you are going to present in the final report or in the results of your dissemination. Only if you think of that stage, you will collect all the information that are required for that without missing variables. So this is an example for dummy table for iodine deficiency anemia study. This is at the analytical stage where we are trying to find the association. So on the first column, you see what are the different exposure, what is the gender, what are the religion, what is the age group, whether they are below poverty or whether they belong to any reserved category. And then the next column, you see what is the prevalence among the exposed and unexposed. Then you find what is the prevalence ratio. So this is the rough table which we would be using at the final stages of report submission or dissemination. So only if you put off these variables and the titles, then you will be able to collect that information without missing. Otherwise, some of the elements could be missed if we don't have a pre-planned dummy tables. Then from this, we expand to the writing a draft protocol. Now we have a concept paper. Now we will see how we move from one-page concept paper to writing a draft protocol. The first draft of the protocol, thought as it is written, uses the concept paper outline, keeps concept paper as summary, and it does not exceed 2000 words. An introduction can be less than 20% of the length, and it should contain 5 to 10 key references. The outline of the protocol is identical to the outline of the concept paper. So in the protocol also, you'll be having a background and justification. You'll be having an objective section, method section, expected benefits and budget. But you will have a detailed description of all these components. So objectives you take from the concept paper, and the remaining areas, the background and justification, expected benefits and budget, you expand the concept paper with full sentences and few additional details. So in your concept paper, you would have written as a one-liner or a bullet point. Now in your draft protocol, you are going to expand that. You are going to add details to what you have written in a bullet point. You're going to add references. So that is how you're going to expand a one-page paper into a 2000 words document. Then in methods, you're required to provide more additional details. So in the outline of the methods, you should provide description of the study design, description of the intervention, study population, operational definition, sampling procedures. So these are the same things we had seen in the concept paper also, but you'll provide details on these elements. So explain how the objectives lead to the indicators and to the study design. And then describe the type of study, cohort or case control or cross-sectional. And then describe the logistical arrangements. Because in your methodology, from the design, you need to explain what are the procedures you are going to do. That will help in understanding how you are going to implement the study. Whether you are going to do a retrospective data or prospective data, and then describe the intervention in terms of whether it is going to be a community trial or a clinical trial, and describe the treatment applied to the intervention and control group, who is going to give the treatment, what is the treatment, when are they going to administer the treatment, and how are they going to administer the treatment, both for intervention and control group. So these details needs to be provided. And then in the study population paragraph, you need to give the definition of the time, place, person. What is the inclusion criteria? What is the exclusion criteria? Maybe added as a separate section, but do not differ conceptually from the inclusion criteria. And do not confuse the study population and the study sample. Study population is the population which we tell anybody in this population is our study population, depending upon your objective. Study sample is among the study population, how are you going to select a particular participant for your study? That is the study sample. Ensure that the study population is suitable to address the objectives. Your study population is based on your objective, whereas your study sample is based on your sample size and sampling strategy. Those are the two differences which we need to be clear. Then we need to provide information on the operational definition, spell out the key outcomes, key exposure, because these are going to be your results in the dummy tables which we previously prepared. So this will come in your analysis. So it is important to define our key outcomes and exposures. For example, in anemia, if you do not define the cutoff for classifying as anemia below 11 grams or 12 grams, tomorrow you will not know whether to classify 11.5 as anemia or not anemia. So you should be very clear in defining your exposures and outcomes. And also it is better you give references. So we mentioned that the WHO criteria for anemia would be used as a definition, operational definition for anemia in the tribal study of adolescent women. Then sampling procedure. So here we describe what is the method that we are going to use for drawing the sample from the study population. So different sampling strategies are there. It can be a convenient sample, random sample, systematic sample, cluster sample. That is dependent on what is the objective and design. And we should provide references on the sampling procedure also if required, and explain randomization if applicable. In clinical trials, we should also explain randomization and blinding procedure. Sample size paragraph, here we should provide details of all parameters used to estimate the sample size, and also explain how the estimates were generated either using software or formula, and provide references appropriately. Next, we move towards data collection paragraph. Here, we should list the data that we will be collecting in terms of what are the variables that you're going to collect, demographic, the hemoglobin blood test details, then the factors like the education, the people in the household, what is their economic status, what is their household income. So all those are the factors that you're going to collect. And then specifics on how the data will be collected. Who will be collecting the data, what instrument they will be collecting, whether they are going to collect paper-based data or they are going to collect digital data. So all those information we need to provide. And then the analysis plan should describe how the data is going to be entered, what software is going to be used, what recording procedure you are going to use, and then In analysis, we should usually follow two procedures, two stages. One is descriptive stage where you estimate the prevalence or incident, and in analytical stage, you try to find the relationship between exposure and outcome in terms of univariate analysis, stratified analysis, or multivariate analysis, depending upon your objectives. Then we need to have a component on quality assurance. So details on how the quality of the data that you are going to collect will be ensured in terms of protocol writing, data collection, data entry, data analysis, and reporting should be mentioned. Then on human subject protection, you need to mention how will you minimize the risk. For example, in terms of doing a hemoglobin test, how will you ensure that you minimize the risk doing the blood prick? You're going to draw blood. How are you going to minimize the risk? By trained investigators who are going to draw blood, by providing them appropriate information, and then have a backup plan in case if there is any emergency situation. How are you going to handle that? So all those are the steps that you take to minimize risk, and also provide confidentiality of how the data would be securely saved. And then maximization of benefits by giving the iron and folic acid supplementation, how they would benefit, and by participating in this research study, what benefits they would get. So that should be explained. And in case if there are compensation, that should also be explained. And how you are going to get the informed consent, who is going to administer that. And in case of people who do not know how to read and write, how are you going to adopt that? And approval procedure, which ethics committee you are going to submit and seek approval. So that should be mentioned. And then prepare instruments and annexes. The data collection instrument, present all the data collection instruments. So you should submit the questionnaires, abstraction form, and structured observation guide depending upon your data collection procedure. And also the drafts may evolve as the protocol evolves. So as I said, depending upon how much revision you make, the quality of the data collection and the protocol will improve, will get improved. And the annexure should contain the standard operating procedures, the training framework for the field workers, the participant recruitment material, the adverse event management form, and the consent forms. And then once we have a draft protocol, annexures, questionnaires, instruments, then we submit it to go for a peer review. So here the rationale for doing a peer review is to obtain feedback, ensure quality, and facilitate ethics committee approval. And submit to experts and colleagues who are experts in methodological area, who are subject matter experts, and then ask for their comments and suggestions, and document how the comments and suggestions were addressed, and then inclusion of the suggestions and reasons for non-inclusion. Because when somebody gives some feedback, you need to think how you are going to address that, or how, if you are not going to address that, or how do you justify in not doing that. This should be documented. And then once you finalize based on the feedback from peer review, then you submit to ethical committee clearance for getting the approval. So here the rationale of getting ethical committee approval is to ensure that the human subject participating in the research are protected and document conformity to the principles of ethical practice and ensure quality. And what protocols are submitted to ethical committee? All research protocols are submitted to research committee. The investigator never decides whether a particular protocol is required to be submitted to ethics committee or not. It's only the ethical committee can make a decision of whether this protocol can be exempted from review or whether it should undergo a full board review. So it is always the ethics committee that decides and not the investigator. And in ethical committee approval, we need to have an understanding on what is the guidance and how the format of the protocol and annexes should be submitted. And we should write a cover letter, and based on the feedback from the ethics committee, we should revise and then resubmit based on the comments, and then follow the direction and include the requested changes. And then once we get the final approval from the ethics committee protocol, we disseminate the protocol, and then we keep and use for future reference. And also we can use that for report writing and for archives. And based on the final protocol, you do your training and all your data collection procedures. And the take home message is always start with the concept paper, unfold the protocol logically from an objective, revise, revise, and revise. Thank you.
Thank you very much, Sriram sir, for that exhaustive coverage of a very difficult topic of writing the protocol for a research paper. And for the benefit of audience who have joined late, we have the meeting live streaming on YouTube. So if you would like to watch the recordings, you can watch it online. We will share the link once the meeting is over. Any questions from the audience to Dr. Sriram?
I would like to add a point here.
Yes, madam.
Dr. Sriram has given a template for preparing a protocol. We apply this template to the topic of our research. For example, one can decide studying incidence or prevalence of anemia among pregnant women. So the pregnant women become the study population. Among the pregnant women whom we are going to assess hemoglobin, that is the study sample. And the study sample is selected according to what is called a selection criteria. Am I going to do it in primi gravida, second gravida, or all, or any age group is involved, associated diseases are there. Like this, we have to select. And then prepare the aims and objectives. Like that, this protocol has to be applied to each individual study. That's what I want to tell you. Yes, told about an epidemiological study. Of course, general practitioners work with public. So whatever they do will be a part of an epidemiological study. So each person, so ENT, what's the topic he wants to do, and then plan the population and plan the sample and then do the study, framing the study objectives and methodology.
Thank you, madam. Anyone who has a question can raise hands. You have an option to raise hands. There are no more questions. We can move to the next topic. So which would be on how to prepare informed consent document. So Dr. Professor Sangeeta Raja would be talking to us in this very important topic of preparing informed consent document. So she is a professor in pharmacology, SRM Medical College and Research Center. And she's been with SRM Medical College since September 2014 in various positions, and she is now currently a professor there. And she is a NAC core coordinator, core member of the medical education department, and she's also the coordinator for MBBS and MD courses in SRM Medical College. She is a bioethics secretary of SRM University. She is a clinical trial investigator in SRM Center for Clinical Trial and Research and SRM ICMR Phase 1. She is involved in several ongoing vaccine trials, ICMR Phase 1 clinical trials. And she's also been a blood bank medical officer until 2011 April. She has underwent her undergraduate from Madras Medical College and she has done her MD from SRM Medical College. She is currently pursuing her PhD in SRM Medical College. Over to you, madam. Sangeeta, madam, you are a co-host now. You can share your screen.
Yes, sir. Yes, sir. Screen is visible, sir.
Yes, madam.
Let me make it in a presenter mode. One sec, sir. 1 second, sir. 1 second.
Yes, yes.
Okay. Um, now I think, is it visible, sir?
Yes, you are in the presenter screen.
Fingers, I'm not, yeah. So, thank you, Dr. Sriram, for such an elaborate and exhaustive presentation. What I would like to begin with for all those who are listening, um, doing research is like how we say in Tamil, kalyanam pannipar, veete kattipar, like that. Okay. So it has got so much of components in it, and each and every component is so much important for us to give us the final product. And for each and every product, every component, you need to put your full effort and commitment so that your end product will come out as a very successful endeavor. And that is actually the process will be very tedious. Sometimes it will be depressing too. But when you complete it and when you accomplish it, when you see the publication with your name on it in a journal, that will melt away all the struggle which you had undergone that. And it is a craving which will again will lead you to do the next one. Okay, so what I would advise is enjoy that process. So it is a process, but every part of it, if you enjoy and do it, it will really be a pleasant experience. So with that, whatever sir had said regarding the protocol development and everything, the protocol is nothing but in a simple terms, because for those who are not into the research field and who have not heard all these terms, it would have been an overwhelming one. So much information, and it will be intimidating also whether we'll be able to do it, or is it worth it, or with the limited time of hours, will we be able to do this exhaustive work? It's nothing like that. You can take it as one step at a time. So you build a protocol basically with whatever topic you're taking. Let that topic be your topic of interest. So if that is the first thing, if you do, then automatically you'll be inclined to it. So you will start to work more towards it. So choose a topic or a title which is more interesting for you, and you have got a general inclination towards that. So once we develop that topic, once we put everything what sir had said, finally, you present it to the ethics. And when you're going to present it to the ethics, when you're submitting the protocol, you also have to submit one more document along with that, and that is called as informed consent. So informed consent is nothing. You are just giving an information to a patient in a structured way. That is all it is. It's in a very simple term. நம்ம என்ன பண்றோமோ அதை அவங்கள்ட்ட சொல்லிட்டு பண்றோம். That's all. உங்களுக்கு இது ஓகேவா அப்படின்னு நம்ம கேட்கிறோம். That is what we are going to do. So this is a process which actually provides essential trial information to potential participants. Potential because they have not yet been our participant yet. So only when they give their consent, they will be our participant, and empowers them to make a rational and informed decision about the participant. Okay, ultimately or finally, it has to be their decision. So why is it important? Why you have to go for informed consent? After they are our patients, right? And we have been, some patients, we have been seeing them for a lifetime. And நான் சொன்னா அவங்க கேட்டுக்க போறாங்க. ஸோ இதுக்கு என்னத்துக்கு நம்ம போயிட்டு பண்ணு அப்படி இப்படின்னு சொல்றது அப்படிங்கிற மாதிரி, if someone is nobody will be like that, but will think why we are making it very complicated, because because we need to follow an ethics in clinical research. That is the cornerstone of any research. And this has come from various things which has happened back in history. Okay. Right from using the Jewish people for experiments, and the very first person, James Lind, who used vitamin C for scurvy. Okay, he used the sailors on the ship, so without asking for their consent, and so many other things. There is a huge list of things. All this has made this regulatory requirement that, see, this is how you have to do it. Okay. So இவ்வளோ இன்ஸ்ட்ரக்ஷன்ஸ், இவ்வளோ ஸ்பெசிஃபிகேஷன்ஸ் ஏன் வந்ததுன்னா, ஏன்னா அவ்வளோ தூரம் பாதிப்புகள் முன்னாடி நடந்திருக்கு. ஸோ அதெல்லாம் நடக்காம இருக்கணுங்கிறதுக்காக தான் we are going in for a strict and protocol. Okay. So it is a legal and ethical imperative for researchers. Legal, if you do not follow it, you can be penalized if you're not going to follow such protocol properly. And it's a document of participants' agreement of study participation. So we have a document or a proof saying that the participant has agreed to it, and we are not forcing him to be a part of this study. And we also has given an autonomy for the participant to choose whether he wants to get into the study or he doesn't want. So what we'll do is we'll give all the informations on the table. This is what we are going to do to it, the pros of it, the cons of it, and whatever we are going to have do for him, and get his confirmation on it and his approval on it. So he decides whether he wants to be on it or not. So we are ensuring the autonomy of the participant. So what are the criteria that should be satisfied by a valid consent form? Okay. So what we have to do is, you have to give the full information, disclose the full information, no hiding, nothing. See, sir has told about that clinical trial. So I've been involved in clinical trial since 2014. The first clinical trial which we did was from Bharat Biotech. It's a rotavirus vaccine, which is also now is in the regular vaccine schedule. So the first 50 subject we have to enroll. 50, those time we used to call subjects. Now it is being turned as participants. Nowhere we have to call them as subjects. Now 50 participants, and those are all 1.5 months, 2.5 and 3.5 months old babies. Okay. So those are our first participants. And I still remember the very first participant's mother, who had come to a pediatric OP, and I'm going to ask her whether she's willing to give her child this new vaccine. Not a new vaccine, it's a phase 3 trial. So all tested for safety, efficacy, and everything. Before releasing into the market, they wanted to know the antibody titer for this particular vaccine. So this is a oral vaccine which was given. So I was telling them that whether they will be interested to give this vaccine to the child. So the first mother who was enrolled in, I still remember her very vividly. She is Mrs. Tamil Chelvi. She is a police constable. And she said, தாராளமா பண்ணலாம் மேடம், நம்மளே ஒத்துக்கலன்னா அப்புறம் எப்படி குழந்தைங்களுக்கு நல்லது நடக்கும். So that was the very first word which I heard. And every time when I start a new trial and when I start to recruit new patients, after that I have been involved in some 11 to 12 trials, and still it's going on. ஸோ ஒவ்வொரு தடவையும் ஒரு புதுசாக ஒரு பார்ட்டிசிபெண்ட் உள்ள நுழையும் போது அந்த ஃபர்ஸ்ட் பார்ட்டிசிபெண்ட்டோட வேர்டு வந்து எனக்கு அப்படியே எதிரொலிக்கும். ஸோ that is the voluntariness the patient should come up with. And we have to have a comprehension of what we are going to do. With competence, we have to deliver it to the subject, to the participants. So when we give, usually what they'll do is, we have to print whatever we have to say to the participant. We'll print it and we'll give that document to the participant. And what we should do, we should wait aramse, and we'll let them to go through that document slowly and steadily till they understand it. Okay. And then if they ask any questions or doubt regarding that, and we should explain to them whatever they ask, how many times they are going to ask, very calmly and composed, we have to answer the question because that is the duty of us. So after doing all these things, even if they are not interested, they have all the right to say, no, I do not want to participate. And we cannot force them. Okay. So what are all the parts of this informed consent document? So the informed consent document consists of two things, two parts. One is the informed consent form. So that is a form the patient is going to sign. The other one is patient information sheet. So that is the sheet you're going to attach and you're going to give all the information regarding the study. Okay. So regarding the project, this project or the clinical trial, whatever you're going to do for, whatever information you want to give the patient, that is a patient information sheet. And after that, there is a protocol, there is a informed consent form where the participant has to sign. Okay, so it has got two parts in it. So what should be the essential elements of an informed consent document? Okay, so it has to state what kind of a research we are going to do it and why we are doing it, what is the purpose of doing it, and what is the duration of this participants, how many number of times they have to come and go. Suppose we are going to have, we are going to test a drug and we are going to ask them to come in 3rd month, 6th month or 10th month like that. So we need to know number of contacts and what are the data we'll be collecting from them, or details we are going to collect from them, and what is the method of collecting it. Okay. And what will be the benefit for this to the participant or to the community, and what is the outcome we are expecting? We are thinking, suppose we are giving a drug A to a diabetic patient and we are telling them this new drug is going to reduce your sugar level to say around 20 points. Okay, so that will be our expected outcome. In this process, if we have any risk or the patient is going to have any discomfort or inconvenience, we need to tell them that also. Yes, it is a thin ice with which you have to walk on it, but it is essential. There is a possibility. Thank you, sir. So sometimes the patient might get intimidated and they'll say, no, I don't want to participate in my study, or I don't want my baby to participate in the study. Yes, that will happen. But still, you got to tell them. Okay. And you have to maintain the confidential, whatever the information the patient is exchanging with you or the participant is exchanging, that is very confident. Okay. And also we will have to give some payment, which can be in like the payment should not be, it should be travel expenses, covering their travel expenses from their place to coming to the hospital, or a reimbursement in case of any adverse events. They have to pay for the charges, buy medicines to cure that, then maybe we have to compensate the charges for their expenses. Okay. So, but this payment doesn't include payment for participating in the study. You are not supposed to pay for the participant to participate in the study. That is unethical. It is not legal. Okay, so which means you're buying the patient, kind of like how they are selling the oat nowadays. It's not acceptable. They have to come on their own, but we can subsidize, we can give this payment for their other expenses because they are going to take 1 day off from their work and they have to travel, they have to bear the travel expenses for the visits which is not mandated for them but for us. So for that we can give reimbursement, but we cannot pay for them and ask them to participate in the trial. And the treatment should be free and they should be compensated if that treatment is going to cause any harm. And at any point during the, since if just because நீ sign போட்டுட்டா கடைசி வரைக்கும் இங்க இருக்கணும் அப்படின்னு we cannot say. They have the freedom to withdraw at any point of time and we cannot coerce them in that. And we have to put the identity of the research team, who is the contact, who is the research principal investigator, his name, address, phone number, any co-investigator or co-principal investigator is there, and ethics committee member secretary's name and phone number should be there, because if at all any violation or any concerns the participant is having, they can even report to the member secretary and they can ask for any help. So what is the additional elements? Any alternative procedures or courses and any insurance coverage. Suppose if it is, I told you about the rotavirus vaccine trial. So any sponsor related trial, there should be an insurance coverage. That is a part of the norm. So those kind of insurance coverage details, sometimes if it is a children that is involved, the parent will be the nominee for that insurance. So those kind of details we have to tell them. And we also have to tell them, suppose we are going to take some samples from them, like blood samples. And for this rotavirus vaccine, for the initial time, we actually took the stool sample. So the storage, sharing, and the right to prevent its use and the publication of photographs. So these are all the additional elements which could be there. So in this, we need to know about legally acceptable representative, LAR. We used to say this very commonly. This is one terminology which will come up. LAR consent is obtained for trials which will involve LAR's legally acceptable representative of that particular participant. The participant can be an unconscious participant, or he can be a minor one, or a patient with severe mental illness or disability. Basically, these are patients who are not capable of providing an informed consent, but on their behalf, their legally acceptable representative could be their spouse or their children or their parents. They can be the LAR who can give consent on their behalf. One thing sir was saying about the children, if the children is involved, we'll not say that as consent, we'll say that as assent. So even if it is a child that is getting involved, if it is less than 7 years, then we need a parental consent. If the child is 7 to 11 years, we need an oral assent from the child, and it should be in the presence of a parent and a parental consent along with that. If the child is, if it is 12 to 18 years, there can be a written assent from child along with the parental consent. Okay. So the consent of the parent, which is the research involving no more than minimal or low risk, then the consent of one parent is sufficient. If more than minimal risk or high risk, then both the parents' consent is needed. And research involving sensitive issues like child abuse and neglect, then parental consent can be waived at times. So what is the responsibility of the researcher? So the researcher should use this ethics committee approved. So whatever the informed consent document you are preparing, that is, you are putting all the information about what sir said, the protocol, the information about the research, everything. And also the patient information sheet, informed consent form, everything you're keeping it ready, and that has to go through your ethics committee approval. Okay, even the informed consent form has to be approved by the EC, and it should be in English, as well as it should have a local translation. The local translation, which has been, suppose it's English and it's translated to Tamil, that Tamil has to be back translated to the English, because they wanted to know in the course of this translation, anything should not have been misinterpreted. You might have played a small game in childhood where you need to say one word in the first person's voice ear, and that person has to pass on that information. And by the time it comes to the last person, the word will be, or the sentence will be changed. Okay, so this also can happen when you're translating from English to Tamil, and Tamil, some meanings might have changed. So a back translation is always needed. And this and all is done by the sponsors in clinical trials. For our local study, for your local study, you don't need to go through such elaborate back translation. So don't get intimidated by it. And the language should be very much simple language. You shouldn't use the jargon of medicine, okay, so that it will not be understandable. So the purpose of it is you have to make the patient, so participant understand, and you avoid restrictions on the participant's queries, and you avoid unjustifiable assurance and influences. Don't tell them this is the wonder drug. If you take this, you will be cured of all everything. Don't give him a superlative um, 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 assurance at all. Tell them what it is, the way it is. And there is one thing called impartial witness, who is an unrelated to the research and should be involved in a consent process if the participants or the legally acceptable representative are illiterate. They are not able to read it. So they will have someone called IW. IW is someone who will not know what that researcher, what is that patient participant, and what is it that relationship with the researcher. Nothing. He'll be a third party, unbiased party. So he will be explaining whatever that is in the consent form, or read it and explain it to the participants. Okay, what is there in it. So when is online consent obtained? This is still in this thing for research involving sensitive information like high risk behavior or any use of contraceptives, emergency contraceptives, especially on unmarried females, etc. So those kind of sensitive information where you have to maintain a privacy and confidentiality, this should be maintained. Okay. What are the challenges encountered when you do this? Suppose sometimes the information will be very complex and lengthy and medical jargons, okay? Those kind of things should not be there. And sometimes the patient will have a poor understanding. You'll not be able to understand the total procedure, what you're going to do it. And sometimes the participant competence may be affected by either being too elderly, any disease, or cognitive disability or mental disorder. So in such patients, involving such participants will be a challenge. And anxiety, fear, cognitive impairment, denial of disease. So these things can be a challenges encountered when the participant has to sign a consent form. Okay. So how you will improve the strategies for informed consent? So use a simplified 8th grade level ICD, informed consent document, and evaluation of the patient understanding, how comprehensive he is. And you can give a brief consent evaluation protocol or quality of the IC form, or the most easiest one is teach back method. So whatever you had told, you can question him and ask him, so what did you understand? So how many times you have to come, how many times there will be blood drawn, how many tablets will be given, such questions, so that you'll know whether he has really understood the thing. Audio visual presentation of the study protocol like diabetic control and complication trial, 6th grade level, and dictionary of the procedural term. So sometimes we have to really make it very simple for those who are really illiterate. So you got to have an
Excuse me, Dr. Sangeeta, can you be little more audible? At times it is not audible.
Oh, okay, ma'am. Let me increase the volume. Yes, ma'am. Actually, the volume is more only. Okay, ma'am.
For me, it is very much audible.
Okay. Okay, sir. Thank you. So there is one thing called audio video recording, audio visual recording, which is in the informed consent process, it is very much mandatory for vulnerable subjects, okay, who are participating in the clinical trial. Vulnerable subjects are those subjects who are either children or pregnant mothers or psychologically compromised person who are not able to make a decision of themselves, or it can be a person who is having some diseases like HIV, which should not be revealed for anyone outside. So those kind of thing where you want to do an audio visual concerning. So only in some cases like anti-HIV and leprosy and all, only audio recording is sufficient. You need not go in for a video recording also. So there is something called electronic consent. That is, the information is written in the ICD can be administered using electronic in a text form or graphics form or audio, video, podcast. But whatever you're doing, there should be an easy approval for this. That should be maintained. Okay. So sometimes you can waive off this consent. There's no need to have this consent, in which all cases, any retrospective studies in which the participants are not identifiable or cannot be contacted, study in anonymized biological samples, you'll not be able to know who is the person's sample it is. Any public health studies or surveillance programs for entire community, they would have done a surveillance program. And if you're planning to do any data, get any data from them, you do not need any consent. And research which is available in a public domain or any during humanitarian emergency or disasters. Okay, so these kind of period, you can have a waiver of consent. So that brings us to the very crisp presentation. I'll also show, I've got one document. See, this and all this elaborate thing is needed for those who are planning for a randomized control trial, okay? Or for those who are having a very simple cases in your OP, okay? You've got a collection of cases and you want to put that as a paper. Then what you can do is there is a simple form, that is a document to be prepared, which I think, let me share. So that document is more than sufficient for you guys to prepare and get it signed from your patients. Okay. But you keep all this in mind. This is the basis for that, why you are asking it, how you're asking it, and what for you're doing it, what is the do's and don'ts of it. But ultimately, what you have to do is you are writing a protocol as per what sir has given. The protocol document is given. You just fill what has to be filled in it. Along with that, you will be adding this particular document, which I'll add it 1 minute. Just let me unshare it. Stop share.
Dr. Saktesh?
Ma'am, 1 minute, ma'am. 1 minute. I want to show this document to them. Yes. So this is seen. Is this?
Yes,
Yes.
we are able to see.
So this is the one you have to prepare, sir, ultimately. Okay. So this was prepared by my postgraduate for her study. So this is what she is going to give to her patient when she wants to collect the samples or involve them in her study. So you put the study title, and if you have a study number, put that, participant name, participant age, and gender. Then I confirm that I have read and understood the information sheet dated for the above study. And all this, I have had the opportunity to ask questions, and all the questions were answered to my satisfaction. Okay, so this thing I'll share with ma'am so that you can go through it. Okay, so the same thing, you should have it in Tamil language also. Suppose if you are anticipating any Telugu population, maybe you have to have a Telugu consent form also. So this will have, and இதில பார்த்தீங்கன்னா I am sure everybody knows Tamil in this one. So பங்கேற்பாளரின் கையொப்பம், தேதி, கையெழுத்திட்ட பெயர், சட்டபூர்வமாக ஏற்றுக்கொள்ளப்பட்ட பிரதிநிதியின் கையெழுத்து. This is what is called legally acceptable representative. ஆய்வாளரின் கையொப்பம், that is your signature, you are the ஆய்வாளர். And சாட்சி கையெழுத்து, suppose if you need an impartial witness signature, that could be their signature. So இப்போ அவங்க இல்லிட்ரேட்டர் ஆகினாங்கன்னா அவங்க தம் பிரிண்ட் வேணா வச்சுக்கலாம், அவங்க கை நாட்டு வேணா நீங்க வாங்கிக்கலாம். So this is how you should prepare. உங்களுக்கு இன்ஃபார்ம் கன்சர்ன் ஃபார்ம், உங்களோட டாக்குமெண்ட், உங்களோட ஸ்டடிக்கு இப்போ நீங்க பண்ணணும்னா நீங்க இந்த மாதிரி ஒன்று ப்ரிப்பேர் பண்ணி வச்சுக்கலாம். ஸோ இதிலே வந்து நம்ம சொன்னது எல்லாமே வந்திருக்கும். I understand that my participation in the study is voluntary and that I am free to withdraw at any point of time. இந்த வாலண்டரிங்கிற வார்த்தை வந்து ரொம்ப ரொம்ப முக்கியம், ஓகேங்களா? அண்ட் ஸோ அவங்கள நம்மளை கட்டாயப்படுத்தலைங்கிறது அது ஒன்றுத்துலேயே உறுதியாயிடும். So without my medical care or legal rights, I understand that the investigator and ethics committee will not need my permission to look at my health records, both in respect of the current study and any future research that may be conducted in relation to it, even if I withdraw from the trial. I agree to this access. However, I understand that my identity will not be revealed in any information released to the third party or published. I agree not to restrict the use of any data or result that arise from this study, provided that such a use is only for the scientific purpose. ஸோ இந்த மாதிரி உங்களுக்கு பேஷண்ட் கிட்ட என்னென்ன கேட்டு கிளாரிஃபை பண்ணணும்னு நினைக்கிறீங்களோ அதை அழகாக நீங்கள் இதில் எழுதிட்டு இதை வந்து அவங்களுக்கு படித்து காமிச்சு இது புரிஞ்சிருக்கான்னு கேட்டுட்டு இதில் நீங்கள் சைன் வாங்கி இதை நீங்கள் வச்சுக்கணும். நீங்கள் எத்தனை சாம்பிள்ஸ், அதாவது உங்களுக்கு எத்தனை பேர் உங்களோட ஸ்டடியில் பங்கு எடுக்க போகிறாங்களோ அவங்க அத்தனை பேர்கிட்டையும் நீங்கள் இந்த மாதிரி ஒரு சைன் பண்ணி டாக்குமெண்ட் வாங்கி வச்சுக்கணும். ஸோ திஸ் இஸ் த இன்ஃபார்ம்ட் கன்சர்ன் டாக்குமெண்ட். திஸ் இஸ் அ சாம்பிள் ஆஃப் இட். உங்களோட ஸ்டடிக்கு ஏற்ற மாதிரி நீங்கள் இதை வந்து மாடிஃபை பண்ணிக்கலாம். ஓகே, தேங்க்யூ. அண்ட் எனி கொஷின்ஸ் ஐம் happy to take.
Thank you very much, Sangeeta Madam, for that very lucid and very simple way of making a very complicated topic easy for us to understand.
Thank you, sir.
Any questions from the audience? You can raise your hands. Dr. Vijayalakshmi, you can unmute yourself and ask the question, madam. I think she has only posted a message congratulating Sangeeta sir for Sangeeta madam for an excellent presentation.
Thank you, ma'am.
Saiminachi madam has also said excellent presentation by both Sriram sir and Sangeeta madam. So if there are no more questions, I think we will move on to the next topic, which is relevant to us as clinicians, because most of us are going to be writing case reports. That's going to be the maximum number of study material that we are going to get from IMA. So how to write a case report by Professor Jamana Rani. So she is a professor and HOD in the Department of Pathology, Bharat Medical College. She has done her undergraduate from Madras Medical College. She has done her post-graduation from Coimbatore Medical College. She has completed ACME course under the auspices of Medical Council of India. And she is currently pursuing PhD pathology in high-grade breast cancers. Over to you, madam.
Yes, sir.
You are a co-host now. You can share your screen.
Yeah.
For the benefit of people who have joined us late, the entire meeting is broadcast on YouTube. So, and I have shared the link to the YouTube live stream in most of our IMA groups. So you can go check it out, the entire meeting, if you have missed any session.
I'm unable to share my screen. Dr. Shaktish, could you please share your screen?
On my email, just give me 2 minutes.
Yeah.
Audio is not coming.
No, sir, I'm just trying to load the slides of Dr. Jamna.
மேம் சித்ராலட்சுமி மேம், நீங்க எத்தனை பேஷண்ட்டை இன்வால்வ் பண்ண போறீங்களோ உங்களோட சாம்பிள் சைஸ் வந்து 100ன்னா 100 பேஷண்ட்டுக்கும் நீங்க இந்த ரெக்கார்ட் வச்சுக்கணும். உங்க
மேடம் மினிமல் நம்பர்ஸ் அதான் இருக்கா மேடம்? மினிமல் நம்பர்ஸ்
அப்படி இல்ல மேம். நீங்க ஏன்னா இது லாஜிக்கா யோசிச்சு பாருங்க. நீங்க மினிமல் நம்பர்னா ஒரு 10 பேர்ட்ட வாங்கிட்டு 10 பேர்ல வாங்கலன்னா, அந்த வாங்காதவங்க அவங்க கன்சென்ட் குடுக்கலன்னு அர்த்தம். நாளைக்கு அவங்களுக்கு ஏதாவது ப்ராப்ளம் ஆயிடுச்சுன்னா, எனக்கு இத பத்தி தெரியவே இல்ல. அவங்க என்ன வந்து இதுல மாட்டி விட்டுட்டாங்கன்னு சொல்றதுக்கு கூட வாய்ப்பு இருக்கு. நீங்க எத்தனை பேர் பண்றீங்களோ, அது 10 பேரோ, 100 பேரோ, 50 பேரோ, 1000 பேரோ எல்லார்ட்டயுமே இந்த கன்சென்ட் வாங்கி ஆகணும்.
ஓகே.
ஓகே.
And the presentation be sent to your mail.
Yes, madam. I've almost got it. I'm just trying to get it on my laptop. I'm
Okay.
almost done, madam. Just 30 seconds. Okay. So I'll share my screen. You're able to see the screen now, madam?
Yes, sir.
Yes. Sorry about the delay.
Yes. Am I audible, sir?
Yes, yes.
Yeah. So I'm extremely sorry about the delay. And thank you so much, Dr. Rukmani, madam, for giving me an opportunity to present on this topic. And after two exhaustive, elaborate presentation, I'm here with the basics on case report writing, which is the basic, I would say, the basic baby step in medical research. Next slide, please. Next slide, please. So at the end of the session, the delegates will be able to, next slide, please, classify epidemiological studies and understand the importance of case report writing, enlist the steps in case report writing, and finally, the most important, that is internalize the importance of research in clinical practice. So these would be the objectives of today's session. And next slide. Next slide, please, sir. So before getting to the topic, we need to understand what is the taxonomy of epidemiological studies. So generally, epidemiological studies are divided into two types, that is descriptive and analytical. So these are the basic types of epidemiological study. And in descriptive epidemiology, we have case report, case series, cross-sectional studies, and ecological studies. Ecological studies are basically population-based studies. The most basic would be the case report, and 5 case reports together would form the case series. And we have the cross-sectional studies, which are also known as the prevalence studies. And finally, the ecological studies, where the unit of study would be the population. Whereas case report, case series, and cross-sectional studies, the unit of study will be the individual. And on the other hand, we have the analytical studies, which in which we have the observational studies and experimental studies. So the details of analytical studies, we will keep it aside. We'll have the basic descriptive epidemiological studies, where today we are going to look into the first basic study design, that is the case report. So why should we have these many types of study designs? Why should we have an observational analytical study? So what is the need to have an appropriate study design? Because it is very imperative. The first step is to choose a study design, because every study design will have an inbuilt feature to take care of the inherent difficulties and challenges involved in the research. Every study design has its advantages and limitations. So by choosing the right study design, our research would be as efficient as possible, yielding maximal information, because research involves our effort, research involves time, research involves money. So choosing appropriate study design is very, very important in the study. So as we have discussed, as you can see this triangle, so the base of the pyramid, we have the case reports, opinion papers, and the letters to editors. As we move up, we have the animal trials and in vitro studies. Then we have the prevalence cross-sectional studies, case control studies, cohort studies. Then we have the RCTs, randomized control trials. And finally, we have the meta-analysis and systematic reviews. So as you can see on the right side, the basic case report, case series, ecological studies, and cross-sectional studies. So they are basically used to generate a hypothesis. For example, in our OPD, we see a lot of PCOS patients, and we observe that most of these patients are obese. Probably, initially we can have few case reports and few cases, probably minimum number for a case series should be 5 case reports. When we combine, we can present it as a case series. And then cross-sectional studies where we can we can generate a hypothesis, we can say the association, we can try to generate a hypothesis on the obesity and PCOS. And as we move ahead with the control groups, we'll do further studies and establish the causality, that is the cause-effect relationship. However, as you can see, the base of the pyramid, which is very, very broad, so that will be the first step, and only with the case reports, opinion papers, we will have further studies happening. So basically, as said, there are two types of studies. One is descriptive, other is analytical studies. So descriptive studies, we have our case report, case series, and all that. So what is the difference between a descriptive and an analytical study? So in descriptive studies, it basically answers what is this particular case, who, where, and when. Whereas in analytical, we will be deciding on how it happened, why it happened. In-depth analysis will be there. Descriptive epidemiology will describe the occurrence of the outcome or exposure. So it won't say whether there is a real association between the outcome and the exposure. It will just say the outcome and exposure. So there is no need of any control group. Whereas analytical, we have to prove the association. So we would need control groups. So basically, descriptive studies are needed to formulate a hypothesis, whereas analytical studies are used to test the hypothesis. For example, prevalence of obesity among diabetics or among PCOS, whatever it is. So that would be a descriptive study, whereas if we want to establish an association between obesity and diabetes, we need to go for analytical epidemiological studies. Next slide, please. So in descriptive epidemiology, the first basic would be the case report. As the term says, it is a detailed presentation of a single case. You're reporting a single case. A unique or a new finding in the case would be reported. So that is what is a case report. And it is a method of descriptive research. So it documents the clinician's experience, thoughts, or observation related to the care of a single patient of a specific condition. So that is a case report. And let's see some interesting examples of case report. As you can see here, so this is a case report on the first confirmed case of COVID-19 infection in India. We can't forget the nightmare of COVID-19 in India. This was the first case which was reported in Kerala. And this particular case report formed the basis for planning strategies in India to combat COVID-19 infection. Following this, many case reports across the country were reported, and we had many studies following which. So after some time, we had another case report which came up, which told the association between venous thromboembolism and COVID-19. Again, initially we thought COVID-19 was a restrictive lung disease with the interstitial pneumonia-like picture. Then we realized it had thromboembolic manifestations, which really helped us to manage the modification. So this interesting observation of the clinicians across the globe. So that is the basis for the case report. So whatever interesting thing which we observe in our clinical practice to be reported to the medical community as a case report. Similarly, HIV virus. So this was the first documentation of AIDS virus infection in 1968. So again, another interesting case report. This was the basis followed which we had so much of research in HIV and AIDS. So anything and everything, whenever it is interesting and unique in our day-to-day practice, it is really imperative to present it as a case report. So unique cases which cannot be described by the usual pattern can be reported as a case report. If there is a variation in the disease pattern that we are seeing in the community. So, these days I'm hearing a lot of orthopedicians saying the prevalence of rickets is very much high among children. So a variation in the disease pattern or a new manifestation new side effect of a drug, or an unexpected complication, a single patient with 2 or more diseases clubbed together, similarly familial pattern. So everything to be reported as a case report. So as again said, when we see the pyramid, of course, case report is the base of the pyramid. So this is the first line of evidence in medical research. So this particular statement emphasizes the importance of having a case report, reporting the unique findings that we see in our clinical practice. So what are the advantages, as we have already discussed? So this is the base and the first line of evidence. It probes us into further research till the meta-analysis stage. It identifies the changing trends in the diseases, identify new side effects of the drugs, and it is the best way to share information to our colleagues. And it is most cited. So these are the advantages of case report. Of course, it has its own disadvantages as well. So what are the disadvantages? See, the cases may not be generalizable. So that particular variation may not be generalizable to the routine practice. So we have to really take the findings with a pinch of salt. And definitely it is not based on systematic studies because it forms the base of the triangle. So it is not based on systemic studies. And the cause-effect association cannot be established. We need analytical studies. And sometimes we would be emphasizing a bizarre manifestation, which can be still misleading to the clinician. So these are the disadvantages. After seeing all this, what are the steps in writing a case report? So first, what is the structure? So whenever we present our findings to a medical journal, so the usual structure is we give an introduction, then we give a detailed description of the case, then discussion, conclusion, references. So this is the usual structure. Of course, we can follow the modified IMRAT structure with introduction, methods, results, and discussion. But for case report, the first one would be the ideal. We can also present or publish our case report in the form of a clinico-pathological conferences, CPC. And we can also do a case presentation template where we'll have a detailed description of the case followed by the topic discussion. So these are the templates, and the first template is most commonly used. Then we'll move on to section by section. So how do we give an introduction? So introduction, you provide a background which will help the reader appreciate the case, because when we read so many articles, it is basically the introduction which will attract the readers. So you give a background, and in the introduction section, always mention what is unique about this case, why this particular case is being reported. If we add a line, it will attract the reader to read further. Followed by case description. So details of the case. Again, aspects related to why the case is being reported. What is unique about this case? Is the age of presentation, a disease of adolescent which is presenting in a pediatric case, in a child which is reported, or a new manifestation, whatever it is. So we have to discuss that in detail, discuss the positive and the negative findings of the particular case. Then relate the discussion section directly to the reason why the case is being reported. So in the details of the case description, we have to give the findings, so that in the discussion section, again, we have to emphasize why the particular case is reported and the evidence supporting the conclusion. What are the differential diagnosis for this particular case, and references to the previously published research material when it is available. And finally, the implication of this particular case, why this particular case is being published. So whether it is related to the clinical patient management, or should we have more research into this particular topic. So again, all these components should be there in the discussion and the conclusion part. So these are all the step-by-step approach when we do a case report. And after doing a case report, where do we publish? General medical journals, specialty, subspecialty, super specialty journals are available, teaching-oriented publications, and there are specific journals which publish only case reports. So some of the examples of the journals. So BMJ case reports, Journal of Medical Case Reports, case reports in gastroenterology, the list is endless. There are many journals available, and general pointers. consult the journal instruction to the authors. So after having all this, read up the journal's instruction and look at the previous journal's issue, read few case reports, so which can be used as a model when we prepare our own document, and thoroughly review the literature and cite the literature selectively. See, case reports are the easiest, the basic steps in research. So as a beginner, you can start with the case reports, and case reports generally have a very short reference list. Mostly it will be less than 10. Some journals accept only 5 references. So cite the literature selectively and consider including 1 or more figures or tables. They usually accept maximum 2 for case report and provide an informative title, so which will again attract the readers to refer our article. Next slide, please. Write in a style that the clinicians find it readable. Make it very simple. So what are the important issues which we need to note when we do the case report? See, obtaining data and documentation on potentially publishable cases. See, this often happens in the busy practice when we decide a particular case for a case report. Again, data and documentation. Sometimes we have to, for medical research, when we want to publish, we may need to document certain negative findings to rule out the differentials, which probably may not be needed in the particular patient management. So, getting the entire data and documentation has to be really in our mind. So, whenever we decide to present a unique case or a different case, we need to refer to the literature and note down what are all the list of investigations which we need to do for the particular case, and we need to properly document the same. Confidentiality of information and photos. So, as previous speaker, Dr. Sangeeta Raja Madam has elaborately told, patient confidentiality, especially when we are using the clinical picture. So, we need to have a separate consent form for that, which has to be signed by the patient. And confidentiality of the photography and information is very, very important. Pertaining to IEC approval, this is a glad news. IEC approval is not needed for the case reports, so we can directly go ahead and publish. And for the teaching faculties, for NMC, teacher eligibility promotion criteria, unfortunately, case reports are not accepted as a criteria for promotion. From case series, everything else is accepted. Case series, original articles, systematic reviews, all are accepted. Case reports are not accepted for promotions. To summarize, case reports are the first and the baseline of evidence. So relevant and timely case reports, as we saw in the examples of the COVID case reports. So timely case reports or the need of modern medicine, they form the base of the triangle. And start your work, you start small, start doing case reports. It is very easy. Use simple language, make it readable to the clinician. And finally, all the very best for your case report journey. These are my references. Thank you.
Thank you, Dr. Jamna Rani. Is there any questions in this topic?
Dr. Jamuna, there is care guidelines for
Yes,
writing
ma'am.
developed by the international experts. Most
Yes,
of the time, it is asked whether it is written according to care guidelines. Of course, whatever you have told, those details given elaborately with subdivisions in the care guidelines. That's what I want.
Yes, ma'am. Even yes, ma'am. Even there are templates available in the care guidelines. In the last column, there will be a template. You can just download that template and edit. All the titles will be there. We can edit the template and use it.
Thank you. It was very nice and easily understandable. Thank you.
Thank you, ma'am. Thank you for the opportunity.
Thank you. Thank you, madam. I think we have come to the end of the session.
Thank you. Thank you. I really, our research committee is doing a wonderful job. Actually, the three presentations are excellent. There was no, not even a single repetition. It was free-flowing statements. I think Ramram is heading for a very good status. Soon we'll be having a lot of publications from Tambaram. Thank you, Dr. Rukmani.
So thank you, sir. It's everybody's contribution, sir. All of us work together and do this. Thank you, sir, for your support.
Good, good, good.
You have been supporting from day one. Thank you so much.
Good. Good night.
Thank you, ma'am. Thank you, sir.
Thank you, Simon and Madam.
Thank you. Thank you. It was
Thank
wonderful.
you.
Nice organizing.
Thank
And
you.
everybody was
Thank you,
too
every participant and seniors for attending the meeting. It was very nice, and we had almost 40 participants in the meeting. And the session is available on YouTube right from the beginning. People who have joined, you can follow the link. I've shared the link in all our groups. You can follow the link. And we hope to have a flurry of publications from our Indian Medical Association, Tambaram, in the near future. So for your information, our first IEC meeting will be held on 21 April, which is a Sunday. So we expect a lot of papers in the opening edition of IEC meeting. So thank you very much, everyone, for joining. Have a good night. Thank you very much.
Thank you.
Thank you. Thank you, Dr. Saktesh, and thank you for everybody who have attended this program, and as well as Sai Meenakshi madam who attended
Thank you,
this
ma'am. Thank
program,
you.
and everybody, every participant we would like to thank on behalf of research committee.
It's an eye opener for all of us, ma'am. Especially for people we've been in the academics, we don't know much about research. Very novice people are enlightened. Thank you, ma'am. Great
Thank you.
efforts.
Thank you. Thank you.
Thank you. Good night, madam.
Thank you, ma'am.
Thank you.
Thank
Good
you so
night.
much.